Good morning, good afternoon, good evening to the veterinarian from the different region in the world. You are welcome to Sri Lanka Veterinary Association second international webinar series. We have organized 16th webinar at the second international webinar series. Our resource persons are well reputed veterinarian in Sri Lanka. This is our 12th webinar. Today our topic is how to manage the tendinitis in horses. Our resource person is Dr. Dammika Perera. He is a senior lecturer, researcher, and a well-known scientist from Bandaging Hospital, University of Peradeniya. And now moderator is Dr. Alexandria Lima from Malaysia. Our president, Dr. Susanta Malwara, is in Nepal for an official visit to establish SAP Countries Veterinary Association. We wish him to continue it in a good standard. Without wasting much time, I would like to invite our moderator, Dr. Alexandria Lima, to introduce our resource person. Thank you.
Good afternoon, all, and welcome to the SLVA International Webinar Series of 2022. Today, we will be hearing from Dr. Dammika Perera, who will be presenting on the topic, how to manage the tendinitis in horses. So a little introduction on Dr. Dammika. Dr. Dammika Perera has obtained his BVSc degree from the Faculty of Veterinary Medicine and Animal Science at the University of Peradeniya in 2004. Later, he earned his MPhil degree in Advanced Reproductive Biotechnologies from the same university. Further, he is a fellow of the Sri Lanka College of Veterinary Surgeons and member of the International Embryo Technology Society as well. During his postgraduate studies, Dr. Perera could establish the embryo transfer technology, embryo splitting technology, and embryo freezing technology in Sri Lanka. Besides, he is the person who has done the first successful artificial insemination of horses, while being the resource person of the first successful sheep AI project and sex cattle semen AI project in the country. Dr. Perera has published more than 80 research and clinical papers locally and internationally during the last 18 years of time. He has been awarded more than 10 professional awards for his clinical, research, and professional contributions, including Perumal Pillai Award, Dr. Hector C. Perera Memorial Award, Air Commodore Dr. RMPA Dasanayaka Award, and Dr. and Mrs. Muhammad Award from Sri Lanka Veterinary Association. Presently, Dr. Perera is working as a senior clinician of the Farm Animal Veterinary Teaching Hospital and a senior lecturer of the Department of Farm Animal Production and Health, Faculty of Veterinary Medicine and Animal Sciences, University of Peradeniya. Thank you, Dr. Dammika Perera, for presenting this topic. To let you know, we'll be having a Q&A session following the presentation. So if you all have questions that you'll want to ask during the presentation, you all can either raise your hand or type it down in the chat box, and we will relay the question to Dr. Dammika at the end. For the duration of the presentation, we would like for everyone to mute their microphones. Thank you. So handing over the webinar to Dr. Dammika, you can start, sir.
Thank you very much, Dr. Alexandria. I think you all can hear me.
Yes, we can hear you, yeah.
Right. I think you can see my screen.
Yes, it is.
Right. Right. Good morning, all of you. Good morning, good afternoon, and good evening, all of you, considering the time zones in different areas of the world. So I am glad to share this knowledge with you all. And I am sure during the discussion period, you may share your knowledge with me, right? So I'm going to discuss about that how to manage the tendinitis in horses. So what is tendinitis? So before that, as you know, so you know that tendons may attach with the muscles, especially in limbs, right? With the it is very much supportive for the function of the locomotory system in equines and even in other animals. So then tendons may attach in between muscles and the right bones, right? For flexion and extension, it is providing very good support, and it is an essential part for the flexion and extension of the limbs in even in equines. So as you can see in these pictures, right, muscles may locate a little away from the expected place, but through the tendon, right, with the contraction of the muscle may provide the force. Then it may transmit to the expected place through the tendon. So then tendon may attach to the required place of the bone. So then it is an essential part for the locomotory function or the function of the limbs of horses. However, due to different reasons, it can cause, it may end up with tendinitis. It may get that kind of complications. Sometimes tendinitis may be due to infectious conditions, or sometimes that may be due to traumatic conditions that can happen there, right? So then the handler or the owner may come to you with complain about reluctant to move or limping of the animal, or sometimes animal may express the signs of that is staggering gait, likewise. So complaint would be like that. Then in your examination, you may able to identify the inflammation of the tendon. So because of that inflammation, animal may have suffering with severe pain, right? So animal may have difficulty to bear the weight. So animal may reluctant to move. So then sometimes they may have to cull the animal because of that situation. So right. So there are three main tendons involving for the main function of the limbs, especially in forelimb. So you may understand the reason to focus the forelimb mainly. So when you consider about the types of tendon, there are three main tendons that we have to discuss. Then first one is common digital extensor, then superficial digital flexor, and deep digital flexor, as you can see in this diagrams. And then here you can see the common digital extensor tendon, right? Located comparatively superficially attached with the coffin bone here, right? Then here you can see the superficial digital flexor in light green color and deep digital flexor in yellow color, right? Those are the main tendons, right, involving in that basic locomotory function, and that we have to consider mainly in our our involvements or in our clinical examinations. So those are the very important tendons in our aspects, right? So usually that tendinitis may be due to disruption of the tendon fibers. So you know that the fiber complex is there within the tendon. So when it damage either partially or completely, or sometimes maybe due to stretching, then end up with tendinitis. So when you look at the most vulnerable tendon, then superficial digital flexor tendon of the front leg is the most vulnerable tendon for the tendinitis in equines, right? Because of their locomotory pattern and location of it, it is the most vulnerable tendon that we can see the tendinitis condition. Then when the superficial digital flexor tendon is damaged, right, there's a thickening of the tendon, giving it to bow appearance when the leg is viewed from the lateral side. So it means you have to, when you examine the leg. So initially you may get the complaint about limping or something like that, reluctant to move like that. When you examine the legs, then you will see the thickening of the superficial digital flexor tendon mainly. So as the most vulnerable tendon for this condition. So when you look at that from the lateral side, as you can see in this picture, this is the superficial digital flexor tendon. Here you can see the board appearance, some swelling of there, in that place. So in different levels would be there, different degrees would be there. So anyhow, externally we can see in our clinical examination, we can see the swelling of that superficial digital flexor tendon mainly. So that is the most vulnerable one. So then, as I mentioned earlier, we can classify that swelling into 3 categories in this region, So the region is carpal region. This is the location of the cannon bone, cannon bone level. Sorry, this is the cannon bone level. So in this level, we can see the swelling when you look at the posterior view of that leg, when standing from laterally. Then sometimes you will see high bow appearance. It means that swelling may locate upper 1/3 of the cannon bone level. So that is known as high bow level tendinitis. So then other one is the most common type. So that is the middle bow tendinitis, So then when you look at the cannon bone from the laterally cannon bone level in a lateral view, then you will see that middle bow level swelling, So in the middle level, you can see the swelling or the bow, as you can see in this second picture. So the third method is, third classification is low bow tendinitis, Then you may see that swelling at the lower 1/3 of the cannon bone level, But that swelling may be along the same tendon, mainly. So, but the level may be vary. According to that location, we have to classify it, into 3 categories. But the most common type is middle bow tendinitis. When you look at the causes for tendinitis, so first one may be excessive straining. Excessive strain would be the reason. Sometimes that may be due to tension, overtension, or sprain, or twisting of the legs, So it is it's a comparatively higher in performance horses. Performance horses. I mean that horses using for the athletic purposes, So races, maybe polo games, different games. So in performance horses, we can see this condition mainly, Presence of overextension of the especially fetlock region. As you can see in this picture, while animal is moving faster or jumping, at the beginning, at the jumping or at the moving faster, in certain occasions, it has to bear the entire weight of that animal plus entire weight of the jockey using a single front leg. So average horse would be around 500 to 700 depending on the breed. So let's say jockey's weight is 60, like that. So while moving, it has to bear the entire weight using a single foreleg, That possibility is there. So then as you can see in this picture, sometimes, so it may cause overextension of the fetlock joint, leading to overstretching of the flexor tendon. Flexor tendon would be supportive for the flexion, but it may cause extension, overextension of the flexor tendon. So then it may end up with rupturing of the tendon fibers, as you can see this in this picture. This is the normal tendon. Then at the overstretching, sometimes it may be swollen, redden. Then at the stretching, that fiber bands may damage, leading to signs of inflammation. end up with tendinitis, right, complications. So other possible cause is poor conformation. Poor conformation may cause tendinitis. So everything may end up with limping of the animal or the lameness of the animal, right? When you look at the poor conformation, this is very important as a weight at the selection of the horses. Sometimes that owners, that handlers may come to you asking your expert support for the selection of horses for them. So in that case, in addition to our clinical examination and other things, definitely we have to consider about the conformation of the, especially legs, right? When you stand from the lateral side, we can see the front leg like this. So as you can see in this first picture, this would be the ideal appearance of the leg while animal is in standing position, right? So when you think about an imaginary line starting from the center of the scapula, as you can see in this picture, right, that should right go towards the ground along the leg, along the center line of the leg, as you can see in this first picture, up to the fetlock joint, right? From the fetlock joint, it may flex towards the anterior side. Then there should have 45 degree, approximately 45 degree in between that line and the right midline of the right fetlock pastern coffin, right, bones. As you can see in this picture, there should have 45 degree angle, right, in an ideal horse. So that is the expected way. So sometimes they may have different, right, variation, different, right, changes of the position. So as sometimes you will see like this in other four illustrations. So when you think about the center line, it may locate like this, right? Leg may not align with the right imaginary line, right? So sometimes you may see like this, maybe due to congenital defects, maybe due to congenital flexion of the right flexor tendon. Sometimes animal may fetlock joint may not have that 45 degree, as you can see in this first picture. In that case, entire leg may move towards the anterior side while animal is in standing position, right? Likewise, so that kind of differences would be there. So we should not select this kind of poses for our clients or our purposes, right? So then the other thing is, when you stand behind the animal, when you think about the imaginary line starting from the right gluteal muscles here, then that line should go across the hock joint and along the midline of the leg up to the bottom, right? Then that is the ideal expected way. So, but in certain horses, you may see, as you can see in other four pictures, right? So that line may not go along the leg. Sometimes leg may be out of the line. Sometimes legs may be right inner aspect of the line, right? Sometimes that may be way in different way. From hock joint, that would be right more extended, right? Sometimes right in the last picture, as you can see that cow hock nature would be there. Hocks may locate closer to each other, right? So when you select that kind of animals, while animal is running faster, or when they are using for the athletic purposes, so that entire weight may not transmit to the ground, right, along the bones, so that it may have high tendency to have the dislocation of the joint, so overextension of the tendons, fractures, so many complications. So we have to select the suitable animals carefully, right? When you stand behind anterior side of the animal, then when you think about the imaginary line starting from the shoulder joint, again that should go to the ground along the midline of the leg, as you can see in this first picture, right? Then again, other variations would be there in animals, as you can see in other right pictures. So we should not select that kind of animal. So that may support you to get different fractures, dislocation, strain, overextension, leading to tendinitis and lameness. So we should not select that kind of animal. So that poor conformation would be supportive for the tendinitis. So the third one is poor trimming and shoeing. So in our usual management system, sometimes owners or the farriers may not manage them well, even at the general management or at the shoeing task. Due to the management failures, they may sometimes people may not apply shoes for certain animals, certain horses. Then they may get damages to their hooves. Then that wearing and tearing would be vary, right? Then they may have cracks, right? Maybe horizontal, maybe vertical, right? Different cracks would be there, and animal may get different wounds, right? Damage. Then while farriers are doing their job, sometimes they may damage to the hooves, right? So that kind of possibilities may lead to tendinitis, because that with the damage, presence of damages to the hooves, animal may have difficulty in bearing of the weight using that leg. Then animal may reluctant to bear the weight, right? Using that leg. Sometimes animal may keep that leg unusual way. Then because of that, sometimes it may lead to over stretching of the tendons or spraining of the leg, leading to damage to the tendons. So that possibility is there. So here you can see the ideal way, right, that we should advise that farriers to do their job, and to others to maintain the hoof appearance, right? So they have to select the proper size of the shoes. Then in proper frequency, they have to do the shoeing and the trimming. In general, for an example, for racers, for race horses, they may trim once a monthly. Then they may remove the shoes, right? Then in each and every month, they may apply new set of shoes. So likewise, they have to practice it as a routine. Then they can overcome that matter. So other factor is improper conditioning of horses. So that possibility is there because of one possibility is under the poor conditioning or the improper conditioning. One thing is poor feeding. So poor feeding means sometimes that that handler or the jockey handler may, or the owner may provide the required feed, but sometimes amount may be low, right? Sometimes they may provide the required amount, but that feed may not be a balanced diet. So although amount is correct, that diet may not be nutritionally balanced diet. So sometimes they may provide the main meal, but they may not provide the required vitamin and mineral supplements. Or sometimes they may not provide proper amount of water. Likewise, so that kind of changes would be there. So then animal may have digestive problem. Likewise, so then not only that, sometimes then imbalance feeding system, right? Then time to time they may change their diet, maybe due to the availability of raw materials. Sometimes their management decisions. Sometimes especially self mixers. Right, self mixers may use different raw materials due to the availability. Then they may not maintain it as a balanced feeding regime. So with those kind of changes may lead to improper conditioning. So then not only that, so poor medical care may lead to this kind of matter. Sometimes if they are not considering about their health status mainly, if they are not worrying much, if they are not getting advices from the veterinarians routinely, then animal may have suffering with chronic conditions. Chronic diseases may be there, but due to the due to lack of the proper attention, they may suffering with that condition. Then although they are providing required amount of feed with the balanced diet, then it may not be useful conditions, right? For an example, presence of improper deworming schedules, right? Improper deworming schedule means sometimes they may provide that correct deworming drugs, but frequency may be wrong, right? So they may not provide it in proper frequency for racing animals. There are different schedules, sometimes in 2 months interval, sometimes 3 months, sometimes 6 months interval, depending on the management system, depending on the epidemiological data and different management system. It would be vary from area to area, but they have to, they should adhere to the proper schedule after getting the advices from the veterinarians. If they are not doing that, so again, it may cause this kind of poor conditioning. Sometimes they may provide that deworming in proper frequency, but they may not provide the proper dose. So then again, it may cause adaptation of pathogens to the right. They may develop resistant types pathogens or the worms. So then again, it may not be a useful treatment. So likewise, so although they are giving the drug, if other thing is if they are giving the same drug for many times routinely, then again same problem would be there. So underdose, using of same drug, right? So then if they are not adhering to the proper frequency, so that those things may cause poor conditioning of the animal, right? Then other thing is poor footing or the hoof care. So they should have pay the proper attention to maintain the hoof condition of the horse, right? As you can see in the first picture, right? If the hoof condition is in a good condition, the hoof, although that hoof is white or black, there should have a glistening. They should have a glistening under normal condition without application of any other oil supplements, right? So healthy hoof should have that glistening appearance, as you can see. When you see this second picture, here you can see the dull appearance of the hoofs. And not only that, in addition to the dry and dull appearance, you can see the cracks here. When it dry, so it may be supportive to have the vertical, horizontal, different cracks. So leading to laminitis, right? So other hoof problems. So leading to any other systemic conditions. So those may be supportive to get the improper walking stance, leading to sprain or the damages to the tendons. Not only that, lack of the proper attention or the proper cleaning system of the hoof daily. So animal may get different pathological conditions. Sometimes end up with canker condition like this, right? At the canker conditions, due to the mainly due to the improper cleaning as a routine. So then it may be supportive to multiply the anaerobic pathogens here, right? Bacteria within the sulci. So then they may anaerobic bacteria may change the growth of the hoofs. Uncontrolled growth may be there within, especially closer to the heel and the frog. So as you can see here, so then animal may have difficulty in bearing the weight, right? Walking stance would be changed. So that may be supportive to have that kind of damages to the tendon. Not only that, so as you know, thrush condition. Again, at the thrust condition, again, that is secondary to management failures. So mismanagement, so lack of the proper cleaning of the sole area of the hoof, heel, areas. So it may, and lack of the proper trimming process, routine trimming. So may lead to multiplication of the different types of pathogens, right? Especially along the sulci of the hoof. So again, that may lead to different inflammatory conditions associated with the hoof. Then end up with the pain to the animal. So pain may cause limping and improper bearing of the weight or the improper walking stance, leading to the same condition. Likewise, so presence of chronic wound, it may cause improper sole area, then malgrowth of the right hoofs, then different presence of unhygienic maintenance of the hoofs may lead to different multiplication of the viral conditions, right? Papillomas, different conditions. So other thing is presence of the dry hoof. Again, it may cause damages to the hoof, right? Likewise, so lack of the proper footing or the hoof care, so it may lead to tendinitis again. So other thing is direct trauma, that also possible, right? Especially for athletic horses, presence of slippery flow or the presence, especially at the slippery flow, then muddy flow, then right presence of sand while animal is running faster, it can get this kind of trauma with unexpected slipping of the leg. So uneven flow may be supportive for this kind of complications. Then other thing is self-injury. Self-injury means some animal that horse is running faster, right? Especially presence of shoes. Sometimes shoes may cause damage to the adjacent leg, or front leg shoes may damage to the hind leg. That possibility is there. So self-injuries may lead to wounds, right? Then different joint matters, joint problems leading to the same condition. So that possibility also there. So in your clinical examination, we have to pay the attention of that kind of possibilities. And while you are getting the history, we have to ask the relevant questions about the last uses of that animal and incidents likewise, right? So other thing is secondary to underlying conditions. Sometimes externally it would be okay. Sometimes with the previous users, animal may have occurred different small fractures, right? Hairline fractures, right? Different other damages. So a little spraying in the joint, right? So then presence of that, then sometimes although that problem is there, hairline fracture is there, handler or the jockey may not understand it, and then they may use that animal continuously. Then again, it may lead to complication of the primary damage, as well as it may lead to the tendinitis again. Right. So what are the signs of tendinitis? So we can see different signs with the tendinitis. So under acute level, so prominently we may see the swelling after heavy exercise. We may see the swelling, right? Then when you palpate, you may be able to feel the heat and signs of pain, right? Then at the I think you can see my screen.
Yes, doctor.
Yes, doctor.
No problem is there. Right. I think you can see the screen. So in the mild cases, we can see the heat. We can feel the heat. When you palpate, you will see the signs of pain. Then mild lameness would be there as the prominent sign. So in addition to that, depending on the severity, other signs would be there. But initially, basically, we may able to see this kind of signs. So under severe conditions, we may see the moderate lameness at the beginning, then obvious swelling, we will see that swelling obviously. Then sometimes rarely that may be that tendinitis would be in the hind legs. In that case, sometimes you may able to notice standing position like this, as you can see in this picture, right? If you can identify, see front leg, animal may try to bear the weight using front leg. Animal may try to transmit the transmit more weight towards the front legs to get a rest to the hind legs. So it means animal may try to push the center of gravity towards the front leg. So then you can see this appearance while animal is in standing position, right? So when although that condition is healed, right? Sometimes, sometimes, most of the time, right? We can see the thickened bowed appearance of the affected part. So that is the matter with that. Sometimes condition may heal completely, but that bowed appearance or the thickened appearance of the tendon may be long lasting. So it may be there. Then when you palpate it, it would have that hard feeling, right? That may last for prolonged period or throughout the entire lifespan of the animal. Then when you look at the diagnosis of the condition, when you look at the diagnosis aspect of it, so diagnosis may be based on the history. So as I mentioned earlier, we have to get the proper history. We have to ask about the many last activities before get the condition. So those things will be very supportive for the understanding of the condition. Then physical examination part, we have to do the physical examination. Then we can go for the ultrasonography, right? So in physical examination, you can, as I explained earlier, you can identify the swelling, then pain, heat. Likewise, then at the ultrasonography, we can identify the hypoechoic areas. Here, as you can see in this picture, we can see hypoechoic areas, right? So compared to the surrounding area, the thing would be due to accumulation of the inflammatory fluid and blood, right, within that affected part. So we can identify it using the ultrasonography, as you can see in these pictures. So other method is we can go for the tomography using the thermal camera, right? We can get pictures as you can see here. Better to get pictures in both legs. Then we can compare the sides using the same picture. Then using the scale, we can have an idea about the severity and the temperature level of the affected part, right? As you can see in this picture, you can see that more reddish tendon here in the foreleg, right? So we may able to identify like that in the affected area, right? And other than that, we can go for the X-ray imaging, right? So with the X-ray imaging, we can get the that image would be that affected part or the probable location would be more towards the radiolucent appearance. So it means that affected place would be more dark in color due to the accumulation of inflammatory fluid and the blood there. So then they may have low object radio density because of that. So then simply we can see the dark color appearance compared to the surrounding areas of the affected or the most probable area. Then when you look at the treatments, so when you get a case like that, so at first, so at the as a first aid, we can advise that our handlers, owners, jockeys to do the control the exercise, right, immediately after the onset of the condition, or when they have doubt about that, we should advise them to control the exercise immediately. Then rinse with water, right? We can use, as you can see in this picture, we can advise them to rinse the affected part of the tendinous area using a rain water, or at least using a bucket of water, as you can see in this picture, right? The thing is, we should try to provide the low temperature or the cold that area. So when you do that, then blood vessels will be constricted, especially capillaries in the right tendon will be constricted. Will get constricted. Constricted blood vessel may not cause or may reduce the hemorrhages into the tendon. So then it may be supportive to minimize the accumulation of blood, right? Other than that, inflammatory fluid there. It means we can try to minimize the swelling of the affected part using this running water, right? It's better if you can find the cold packs or the ice water, right? Or Then if we can find that Colfax, then we can keep that Colfax on the tendon, or we can keep that PAX on the tendon and we can wrap it, keeping against the tendon, right, to reduce the temperature there, as I explained earlier. So if you can't find, sometimes this thing can happen, right, while walking animal in maybe somewhere away from the its usual place. Sometimes they may have difficulty to find the right Colfax. It may not be available there. In that case, at least we can use a bottle of cold drinks, right? We can purchase it from that hotel or a place like that. Then we can purchase a bottle of cool drink. Then we can keep that bottle against that affected part. The requirement is to reduce the temperature in that place, right? Cold temperature may be supportive to minimize the internal bleeding. So other thing is, after that, after the immediate treatments, we can apply the cooling agent. It would be supportive to again maintain the low temperature there, right, to stabilize the condition. The other possibilities, we can for the long-lasting treatment, we can start application of analgesic externally, topically. Application of analgesic, we can go for the diclofenac sodium, right? For an example, we can, while we are applying that external cream or the lotion, we have to apply it gently. When you try to apply it vigorously, right, so without much care, it may further complicate the condition, because we may vibrate the internally damaged tendon. So again, blood clots may damage, internal bleeding may start again. Carefully, we have to do that. Then other thing is, next one is, we can go for the systemic anti-inflammatory drugs. For an example, we can use flunixin meglumine or ketoprofen, right? We can directly inject parenterally, intramuscularly, or intravenously, right? May have the more effect. So then using that, we can try to have the stabilize the condition, right, as the next step. So then to provide the external support, we can use bandaging system, right? Externally, we can support the tendon to minimize the damage, right? To minimize further vibration within the tendon, further damage within the tendon, we can apply bandaging to stabilize it, right? For as a long-lasting supportive treatment, we can apply a bandage, especially but although it has the damage there, we have to provide that gradual exercise to the horses. Otherwise, they end up with colic or some condition like that. So horses should have regular exercises, but we can give mild exercise, right, depending on the severity, right? We have to decide that considering after analysis of the condition. So, but anyhow, we should try to provide the mild exercise if it is possible. That is to minimize the probable other complications, conditions like colic. So then before use that animal for the exercise, better to apply that elastic type bandage to the affected area, right? So then, as you can see in this first picture, we can use a type of a crepe bandage, likewise, right? Thin type of elastic type bandage that would be supportive to minimize the probable damage further, right? Then then after that, then when you put that animal into the stable, then we can apply a thick bandage, as you can see in this second row, right? We can use pads. We can use padded bandage. Different types of pads are there. So we can keep that pad and we can apply a thick bandage as an external support to the tendon. Then other possible treatment is we can go for the ultrasound guided infiltration of plasma rich platelets to the affected part, right? So it acts as a growth factor. using as you can see in this picture, using an ultrasound guide, right? We can try to inject the that growth factor or the plasma, right? So we can get the blood from the same animal, right? Then we can separate the plasma and we can inject it, that concentrated plasma. It would be supportive as a growth factor to healing process of the damaged tendon, right? So other possible treatment is we can, if we have that facility, we can go for the intratendon injection of mesenchymal stem cells, right? We can inject it to the affected part of the tendon. So as you know, right, mesenchymal cells can differentiate into, right, many other cell types, right, according to the requirement of the, right, influenced by the surrounding cells, right, available surrounding cells, that right, injected mesenchymal cells can differentiate into the surrounding type of cells. It means it would be very much supportive to heal the affected or the damaged area. So for that, we can introduce that mesenchymal cell, right? So we can use we can get mesenchymal cell from the bone marrow, right? Then we can inject it to the affected part of the animal. So for the prevention, we have to do the correct trimming and shoeing, right? So as I mentioned earlier, as a routine, we should advise them to practice it as a routine once a month, right? Especially for race horses. Then we have to use a well-trained farrier for the task, right? Then we have to use the correct instrument for that, right? Then we should advise them to use the suitable size and correct type of shoes for the right task. Then we can minimize that kind of problem. So other thing is bandaging, right? So we can use that, we can advise them to apply the right bandage to the most vulnerable area, as I mentioned earlier, right, around the cannon bone, right, to cover the right possible tendons, right? As an external support, we can apply a suitable type of bandage, right, before use that animal for the exercise. So it would be supportive to minimize the probable tendency for the tendinitis. So other thing is checking the legs as a routine. We have to, after the exercise, we have to check the legs, right? For that animal may be at the early stage. So if you are not caring about that, when you use the second time that animal for the same task, then end up with the right complicated situation. So as a routine after the exercises, better to check, better to palpate, better to see the most probable or the most vulnerable areas, right, daily. So other thing is that presence of any, right, in your examination, right, and with the presence of the proper attention, sometimes you may be able to identify the right high temperature or the pain in that place, or mild swelling. In that case, we have to stop the training, right? Then we have to provide the pay the attention, or we should advise them to get the veterinary advice to overcome the matter. So other than that, balanced diet, veterinary care, and management would be, as I explained earlier, would be very much supportive for the maintenance of the right proper condition. That would be supportive for the prevention of the tendinitis, because that strength of the muscle, strength of the bone, strength of the tendon, right, may depending on the proper nutrition, right? And veterinary care would be veterinarians having a good role. So in your each and every examination, we have to consider about the right condition of the tendons and the most vulnerable, especially most vulnerable tendons. We have to observe that. We have to check for the changes of it likewise. So for more details, you can go through this right sites. And thank you very much for your kind attention. And I would like to extend my thanks for the owners of certain pictures that I have taken from the internet as well. And thank you very much for your kind attention.
Thank you, Dr. Dammika, for that very informative presentation. So now we will open the floor for questions. So if anyone has any questions, they can unmute themselves and ask Dr. Dammika directly, or they can type the questions in the chat box.
Yeah, if you have any questions, right, when you type in the chat box, I can see right even directly. I can see one question here in the chat box. After rupture of tendon, is there any chance to use that animal for race purpose? Right. I think you mean after the incidents, then whether we can, after our proper treatment, right? I think you're asking whether we can use that animal for the same purpose like that. So yes, we have to get a right management decision about that animal, because horse may not run alone, right? That animal may keep a jockey on its back. So we have to get the that's why I told you that we have to get a management decision, because that it has cured completely, but that may not be may not have that 100% strength as the natural way. So then we can't give that any risk to the jockey, right, or the rider. So because of that, considering those aspects, most of the time, right, in this equine management, we may not use that animal for the same athletic task. We may use that animal for any other task, right? So considering about that risk factors. There's another question. How long will it take a badly damaged tendon to fully recover and use the horse for racing, right? So presence of, as I mentioned earlier, right, although people are using in certain conditions for the same purpose, but it is not much advisable considering the risk of the jockey. So then here, as I think that's you're asking about the time period that required to recover. It's depend on the treatment, right? So if you are delayed to provide the treatment, sometimes condition may be complicated. If you are doing the treatment from the beginning, right, animal may recover faster, and there are other factors, right, nutritional status of the animal, right, immunity of the animal, right, depending on that. Time would be vary, but we may have to give a proper attention and the rest until another 2 months period, right? It will take time like that, time period like that. So in addition to that, we have to consider about other aspects as well, right? Have to have proper treatment, proper management, proper caring, right, throughout the period.
There's another question.
Dr. Andrea, I can hear another question. Yeah, what is the possibility possibility of recurrence of the tendinitis. Yes, as I mentioned earlier, that once it damaged, although it has healed properly, that such animal having risk, right? Again, that is depending on the usage of the animal after the treatment, right? If you are using the animal for the same task, it means same task mean let's say that it has happened in that racing horse. After that, again, if you are using for the racing purposes, that animal is under high risk. So if you after that incidence, if you are using for the mild work or any other let's say that safari purposes for just to ride it, that animal having a low risk, then without trouble we may able to manage that animal. That's why I mentioned at the earlier, after the occurrence of that kind of condition, we have to get a management decision to change the purpose of animal, using there. So that is the best way.
There's another question, Dr. Dammika. What are
the essential vitamins and mineral supplements in tendinitis condition? Yes, to maintain the health of the muscle, and strength of the tendon, there are many vitamin and minerals involved. There are many involvement of the minerals and vitamins, especially presence of low level of vitamin E, selenium. Those are may lead to damage of the tendon and the muscle, may cause weaker tendon, weaker muscles, especially presence of low levels of vitamin E, selenium. So it means we have to make sure to provide the required amount of or the standard amount of vitamin E, selenium in a daily diet. Dr. Andrea, that's all so far I can see here in my chat box. Any other questions? You are welcome to clarify those things.
There's no questions in the chat box. If anyone else just wants to ask Dr. Dammika directly, even they can feel free to. Dr. Dammika, if it's okay, can I ask you a question?
Sure.
Yeah. For the tendinitis, the ruptured ones, is surgical procedures an option?
Yeah, we can try even using surgical methods, So even other animals, even for other farm animals, or the pet animals, we may use even for human beings,
Yeah.
That is one of the option we have. We can do the surgery, then we can correct the damaged part. We can put sutures, especially in that case we have to use that tension type sutures, so cross mattress, fania, fafa, that kind of we have to go for the tension types sutures, then we can correct it, for in equine practice,
it's a little more difficult due to the general anesthesia.
That's a little yes, it's a difficult task. Because of that, that is not a when you make a list of treatment, that may go to the bottom. That option may go to the bottom of that list, likewise.
Okay. Sorry, second question is, you mentioned that underlying...
That's another question.
There's a question?
Yeah, sorry.
As you have a wide experience of AI in horse, can I ask about the success rate of AI in equine?
Yes, although this is not related with this topic, he or she is asking about the success rate of AI in equines, So again, it's a broader topic. We have to have a separate, I think, session for that. Then when I explain it simply, that success rate again maybe around, in general, it may be around 50%. When I explain it without considering much detail, in general it is around we can go for 50%, but success may depending on the experience of the technical person, right? Then quality of the semen, right? Or the sperm, quality of the sperm, then detection of the heat properly or the synchronization, then right animal factors are there, that hormonal support of the right animal, then they may have sometimes concurrent uterine conditions of the animal, right? Then the age of the animal, that old animal may have lengthy reproductive tract, right? Sometimes congenital defects may be there, you know, as you know that uterine unicornis conditions would be there, right? That kind of, right, different factors are there, right? Depending on that, success rate would be vary. In general, right, it believe, right, like that.
Do we have any more questions from the floor? Okay, I think if we don't have any more questions, I can hand over the speaker over to Dr. Chamari for the vote of thanks.
Thank you very much, Dr. Alexandria. On behalf of Sri Lanka Veterinary Association, I would like to thank our resource person today, Dr. Dammika Perera, for your very informative presentation. Thank you very much, Dr. Dammika, again for accepting our invitation and doing the presentation today. You are always willing to help Sri Lanka Veterinary Association as one of our executive committee members. So thank you, Dr. Dammika, for your valuable service today here as a resource person. And next, I would like to thank our moderator today, Dr. Alexandria de Lima. Dr. Alexandria joined from Malaysia. So thank you very much, Dr. Alexandria, for your voluntary service. Today as the moderator, and also for accepting our invitation. Next, I would like to thank our president, even though he is not here today physically, and also Dr. Sugat Pemachandra, our former secretary, and all the executive committee members of the Sri Lanka Veterinary Association for your continuous support. And finally, I would like to thank all the participants who are here today, those who have joined from Sri Lanka as well as from the other countries like India and other South Asian countries. And also the students, I can see large number of students joined today. So thank you very much for joining with us today. And also I would like to invite all of you to join our next webinar. Our next webinar will be held on 24th June, that is next Friday at 1:00 p.m. The topic is medical and surgical approach to block cat. The speaker is Dr. Vipuli Kulasekara. Dr. Vipuli Kulasekara is a small animal practitioner who is practicing in California, USA. So I invite all of you to join our next webinar on Friday. And also those who have missed our webinar today, as I'm always informing at the end of this webinar series. So you all can watch our webinars later by logging into SLVA YouTube channel or SLVA web page or SLVA Facebook page. So thank you very much again and have a pleasant weekend. Thank you.